we begin? Um, there have been some great trainings so far this morning that I was able to check out. And some of the training today is going to build off of other kind of similar trainings and concepts. But before we begin, I always like to do an introduction, even before the context of the training. Introductions to me are a part in group therapy of safety, right? Safety and introducing yourself. So I thought I would start with that. Some of these are various intersecting identities, and hopefully they kind of put me in context and of maybe parts of myself that I bring to the work. So I am a white, heterosexual, cisgendered female. I'm Jewish, so that's an ethno-religion. Many people think of it only as a religion, but it's more closely considered to almost like tribal, that there's holidays and such like that are geared towards agriculture and the land and things like that. I'm third generation American. I'm a part of a diasporatic group of people, right? So been exiled from various lands, so not really, kind of bouncing around in kind of personal history. I'm a native English speaker and just an English speaker. I'm middle class. I have a master's degree, so college educated. Child-free, partner-free and dating, which is an identity that needs to be discussed more in the context of therapy. I'm left-handed, I have multiple invisible disabilities, and and 3 of the 4 past generations of mine have worked with immigrants in the therapy context in some particular way. At Nationality Service Center, so I'm Rebecca Ash. I don't know if I fully even gave you my name. At Nationality Service Center, I function as the lead therapist. And by training, I'm an art therapist and I have my LPC, so licensed professional counselor. I've been in practice now for, I guess, about 12 years, postgraduate. About 11 years ago, I joined NSC for a 2-year-long survivors of torture art therapy group. And about 6 years, and then was doing other work, worked in inpatient psych, worked in community centers and various other settings. And then 6 years ago, I joined the wellness department as the lead therapist and an art therapist. And so much of my clinical framework today is coming from the context of being an art therapist. So that's a little bit about me. So this topic may speak to a lot of you today. There's 15 of you who have joined, and possibly because you are working with individuals as a non-community member. And even if we share, let's say you share the same language as your clients, you might not be from the same country, or you might not be from the same socioeconomic status. So oftentimes, and that's just an example of language, oftentimes we are different from our clients. And as there are increased levels of migration and refugees, people fleeing due to war, economic crisis, or sorry, economic opportunities or climate crisis, we're confronted more than ever with the growing demand for mental health services. So each topic in this training is a dissertation of itself. And I really want to highlight that. I am not speaking as an expert for any of these topics because it's so big. It's like someone saying to you, do what is in the context. Each of these things that I will talk about are, like I said, a whole course in and of itself. So it's going to be a brief overview and hopefully highlighting some unique challenges that come with this work when you are not from the community that you are working alongside. And also there are some really interesting opportunities that you have when you're not from the community. So before we kind of dive in to the PowerPoint today, I'd like for you to just take a moment, kind of take a deep breath, get centered in your body, in the chair, in the room, and consider any images or any words, any feelings that are brought up when you think about this trip. So just take a moment. And if you wouldn't mind putting in the chat box a word, an image, a sensation, anything related to that that comes up for you when you think about this topic. Okay. While you're doing that, I'm going to put my PowerPoint up. Let's see. Actually, if I can. Oh, where's the share screen? Let's see. Gwen, do you know where it has gone? Do I have the ability to share my screen? Ah, very good. Okay. Great. We're having some coming through the chat.
Rebecca, I'm
Okay.
sorry, I couldn't respond right away. It looks like you're sharing. Everybody needs to respond through the question and answer just because it's a webinar. So if you can put your questions and comments in there.
Wonderful, wonderful, great. Yeah, respond through the Q&A. So some information is coming through. Someone mentioned ocean, sunshine, beach. Another person said privilege. Wonderful. Yeah. So just take note of that. Whatever word is coming up for you, sensory experience, imagery, whatever it is, just take note of what comes up for you when you are thinking about working with immigrant communities as a non-community member, right? Okay. So we're gonna jump in. Okay. So a little bit of context is important when we think about working with immigrant communities. There have been shifting trends over the years. In the early 20th century, there was an individual focus, right? That was when it was very pathology driven. There was a belief that practitioners could treat anyone regardless of their background. And the therapist expertise was emphasized. This was around the time of Freud as well, right? So that sort of like therapist knows best. They're the expert in diagnosing, they're treating psychological issues. Then in the mid 20th century, we moved towards an awareness of cultural differences. That's when cultural competence, right, began to emerge, emphasizing the need for therapists to understand their clients' backgrounds and their expertise, right? And then by that time, there was a growing recognition of the importance of cultural context in therapy. The civil rights movement had increased awareness on social justice issues, which prompted some therapists to begin to consider their approaches. The concept of cultural competence began to emerge, emphasizing the need for therapists to understand their client's background. But it was just kind of to understand. And then in the late 20th century, community and identity started to emerge a bit more. There was the rise in identity-focused movements, highlighting the importance of shared experience and the therapist's identity in the relationship. So the therapist's identity is starting to become a little bit bigger. And so that was, what a lot of different theories kind of were coming into play. The mid 20th century too, that's when the civil rights movement kind of increased awareness. That was really important. And then the identity focused movements that were happening more in the late 20th century were feminist therapy, LGBTQ affirming practices, and multicultural therapy. And these movements highlighted the importance of shared experiences and the therapist's identity in the therapeutic relationship. So the idea emerged that therapists could better serve their clients if they had similar backgrounds, right? Which that kind of makes sense. And then kind of the trend right now, or in the 21st century, is more community-centric approaches. So there's a strong emphasis on community psychology and systems theory, which focuses on the role of social environments in mental health. So the therapist's role is becoming more important, and advocating for practices of collective healing. So kind of the current trend is really moving from the belief that therapists can work with anyone to a focus on community and cultural similarity, which represents a huge shift in kind of honoring the human experience and also the importance of relational dynamics in therapy. So safety and trust, the one thing that's interesting to think about is that safety and trust are more easily established when sharing cultural identities for some clients. And being a non-community member can result oftentimes, well, not oftentimes, but it can result in a misdiagnosis for some clients, right? You're missing different cultural nuances, language, there's different things going on. Clients can be misdiagnosed, misunderstood. Also, there can be an inability to convey empathy, which is really important as well. I have found this to be a particular issue with using language services. When you're using an interpreter, you have three people involved, right? And if you forget that your interpreter is a person, you're using them almost as like an app, as a language service. And so you kind of, you're just so focused on getting the information across that like there's an affective component that can go missing. It's hard to convey empathy with clients. However, as refugees and as migrants increase worldwide, as I had mentioned before, it's unrealistic to have all cultures and languages accessible at any given moment to those who need it. It is the goal, right? It is the goal to feel like you can find a therapist that represents you and who shares similar cultural identities. However, we do need to be prepared to work with clients who we have differing experiences and cultures. We have to figure out a way to bridge various cultural and linguistic needs. And throughout this experience, feel free to put in the Q&A. Doesn't have to be a question. It could also be an observation or a thought or anything like that. Because my sharing screen is paused. Hold on 1 second. Can people see the PowerPoint?
Yeah, it has the shifting trends on it.
Okay. Just doesn't have the screen to move forward. It says your screen sharing is paused. Okay, let me get back. Did that work?
Not yet.
Okay, just stop for a second and then start it back up again. Maybe that'll work. Or differences, right, between you and your client are one of the most obvious and one of the things that you encounter one of the first things you encounter, sorry, when you're working with someone from a different community. And it has to be addressed, right? You have to figure out how to communicate with your client. So I was looking up some language quotes to sort of capture the essence of what language means in our work. And I found this quote that maybe many of you have heard of by Nelson Mandela. So it's, if you talk to a man in his language, it goes to his head. If you talk to him in his own language, it goes to his heart. For that, I thought, oh, that's great, right? To do therapy, therapy is like the work of the heart. It's the work of the soul. You're trying to reach someone in their most tender, most vulnerable places. And how can you do that if you don't speak the same language as them? However, upon further investigation, I found out that that's actually not the correct quote. And the real quote is, because when you speak a language, English, well, many very people understand you, including Afrikaners. But when you speak Afrikaans, you know you go straight to their heart. And that was in a conversation with Richard Stengel in 1992. And likely he was referring to Afrikaans, the language of the oppressor, and probably referring to his prison time and a language that the prison guards, prison guards were to have spoken. So I love this quote that's sort of used widely on posters, and I love the actual real quote because I think it speaks to three things about language. First, the adapted quote, the sort of reduced quote is beautiful because, like I said, it speaks to how important your own language is, and that we have an ethical obligation to make sure that our clients can really understand what they're being told, right? Especially in therapy, especially in mental health, especially in physical health. The other reason why I kind of love this is the actual quote is a reminder that language is power, and that when you withhold access to it, we limit our clients' agency and autonomy. In art therapy, we talk about language supporting defense mechanisms. And so, through language, you can rationalize, you can intellectualize. All of those are really important defense mechanisms, especially when a client is just getting to know you, building rapport. And it's especially important when doing trauma work, right? You don't want to take down people's defenses. You want them to be defended. You want them to have the ways that they communicate, they rationalize, they understand the world, initially to help them, right? To help support them, to meet them where they're at. And so I just think that it's really interesting that the power that language holds, and how he was in this quote, he was really able to speak, use it to leverage some power to get to maybe the prison guards, right? To really like understand them for whatever reason. Well, I'm sure there were a lot of good reasons being imprisoned, right? And trying to connect with them and level with them. And then the third reason that I love this is sort of it explains what you have to do in this work, right? You can never take anything for face value. You find something that makes sense, or you take your your basket of cultural knowledge about a client. You can't take it at face value. You have to continue to stay open and to stay reflective about this work. You have to do more research. You have to lead with curiosity. You can't take anything for face value. So that was a great reminder for me of that sort of reflective process you have to be in. So to continue to speak to language, it's really important because those who have language differences and don't speak the native language of the clinician or the country that they're in, they tend to have poorer health outcomes. So their physical health suffers. We talked about before that there are more misdiagnoses, right? So they have poorer health outcomes and they have more adverse health events. So actually things go wrong because they are not understood, right? They report a decreased distrust and overall just general dissatisfaction when there are language barriers. So how do we navigate language barriers? Sorry about that. My dog is yelling. I'm gonna go get my headphones actually. Navigating language barriers. So this is an important reminder to everybody that I've worked in many agencies that don't know the process for accessing language line. They don't have protocols, they don't have funds. So this is all of our reminders that it is not only unethical to not offer language services to clients, but it is illegal. right? So I'm like, how do I say that in a very gentle, soft way? There's really no way to say it. It just is what it is. And we need to help our agencies sometimes with care, with love, right? We need to help them create protocols that are responsive and responsible to our clients, right? It is the best practice to use interpreters, whether it's through an interpreter service or whether it's through in-person interpretation, or of course, the best is a bilingual therapist, right? But it is critical and incredibly important. Okay. There are parts of, there are parts of the brain in an acute stress experience or trauma that shut down, that control language. So even if your client has the ability to speak English, maybe not proficiently, but like they can get by, it's not good enough, right? We have to offer them language in their native, we have to offer them interpretation in their native language. So through this training, I'm going to pepper in some just quick stories and to kind of highlight some of these issues. We were working with a woman for a very long time who spoke a native African dialect. In addition to that, she spoke French. However, she was pre-literate and she didn't quite speak French and she didn't quite speak this dialect. She kind of spoke her own version of it, and an external case manager actually was the only person who could really understand her. But French was still more comfortable than English. She went to be assessed for kind of acute stress and for inpatient psych. So when we brought her to the hospital, the case manager and I were in constant conversation and knew that she never wanted to have an interpreter. She just didn't prefer that. We had to remind her, you have to have an interpreter just to know what they're saying. You can make whatever choice you want, but like it's important. So she agreed to it. But then at the hospital, when you've got doctors there and intimidating people and it's very sterile and chaotic, it's going to be something that a client will forfeit because they don't want to be a nuisance, right? They just want to get on with it. And so we had to have conversations with the doctor that you have to have an interpreter there. And just to remind the doctor too, if she chooses not to have an interpreter, the things you're having her sign, she's pre-literate, and the things that you're having her verbally agree to, she can't understand. And so it creates a really big ethical conundrum of, okay, this is the client's will, right, and desire to perhaps not initially have an interpreter, but they don't understand what they're agreeing to and signing. And for our clients, it's really important that they do agree just for their immigration status and inpatient, and if they were to go in voluntarily or involuntarily, that is a legal situation too. So we take those language barriers very seriously. So interpreters. I'm so curious to know, for those who are here, who has worked with interpreters before? I don't know if there's a way to, oops. Oh, cool. Loving the hand raising. Yay. Great. Oh, love it. The numbers just keep going up. 7, 6. Okay, cool. Awesome. That's fantastic. Great. So many people have worked with interpreters. I don't know why I can't access the chat at the same time, but I'm curious if people in the Q&A, no, never mind. Well, feel free to do it. I'll come back to it. But feel free to pop in the issues or like what's one challenge that you find in working with interpreters. And we'll get to that. Interpreters, okay, so the challenges, right? One of the biggest challenges is that typically there's no mental health training for interpreters. It's called medical interpretation, right? They're trained to do hospital interpreting and to understand various medical terminology, but not necessarily mental health terminology. Here at NSC, we've tried to tackle this issue by creating a mental health interpreter training that we have. I don't know how many trainings we've done. We've done a lot of trainings. We've trained a lot of interpreters. And it's interesting how prior to that training, No one else, they had never received any training at all, which was, in my opinion, pretty problematic. It's really intense work, right? It's really intense work. It's full of trauma. You're speaking in the first person, right? Can you imagine sharing someone else's stories in the first person day in, day out, right? So it's really taxing. And what that means is that supervision was desperately needed. You know, as therapists, I'm assuming many of us, if not all of us, are therapists. As therapists, we have supervision, right? We go to supervision to get support from our peers or from a clinical supervisor. It's sort of a mix of like emotional support meets education, right? Psychoeducation. And so interpreters don't have that experience. They don't get to decompress. They don't get to have that reflective experience of like, wow, that really brought up something for me. That was really hard to say those words. So NSC also, in response to that, did create some supervision series for interpreters. So I think a lot of what we do with interpreters at NSC is we're trying to look for the gaps. And Mina's done a fantastic job, and Gwen and Natalia and all the lots of different people who are creating programming and support for our interpreters. The other challenge is, are they from the client's community? Does the client fear being known by them? Do they know the client, right? Another thing that we've come up with or come up against is the interpreter from an opposing political party or tribe, right? That can be really, really challenging. Yeah. So some considerations when working with interpreters. I'm sure many of you have this experience, but kind of informing them the nature of the appointment. I always like to tell people that this is a therapy appointment. Are you comfortable with that? And I will ask if people are comfortable, because I want people to have the opportunity to say no. And sometimes I'll say it's okay if you're not, right? Just to give them that opportunity. The other consideration is this going to be a consistent interpreter, or is this a one-time interpreter? Is this someone you're going to be scheduling with? Is this in person? Is this someone at your agency? Or is it going to be different every time? That makes a really big difference, to have a consistent or a different interpreter. You also may want to consider sharing not only the client's language, but also the client's dialect and their country. I've had some Arabic interpreters who maybe are from Egypt, and I need Sudanese Arabic interpreted. And some have said, I can't, it's really just too different. Whereas I've had others that have said, okay, yeah, that's no problem. And I always say, if it ever becomes something that's too challenging, if the interpretation is just, isn't working out, please just let me know. The other push that we are trying to do, I think, here at NSC is to acknowledge that an interpreter is just not there necessarily to interpret, or at least when it functions the best, the interpreter also serves as a cultural broker, and they really help to support and emphasize the interpreter-clinician partnership.
Rebecca, I'm going to interject a question here. That's a question and answer. Sometimes it feels as though they don't portray the same emotion behind their interpretation as I do.
Yes. Yes, absolutely. I think these can inquire about affect. Yes. Yeah, the affect piece is really, sometimes it can sterile exchange of information, not exchange of like affective information, affective information. Yeah. Something that's interesting that I had to do once after a conversation with a client. I was the last session, and it was the last time we were meeting. And at the very end, I was just getting, the client sounded heated, right? And I knew the client fairly well, but not, not, it was a shortened, maybe we had like 10 sessions or something. And We hung up the phone, but before we hung up with the interpreter, I said, interpreter, can I ask you a question? Once again, this is kind of serving as like cultural brokering. I said, I was picking up, even though we were asking the client, I was picking up on the client that they were irritated by me because the interpreter was not conveying that in their interpretation. I said, did they sound irritated to you? And the interpreter said, yes, they sounded irritated. I said, great, which allowed me to kind of call back the next day and just to smooth things over. But it is really difficult. Sometimes you don't get the emotional content. So much is expressed non-verbally, right? Mannerisms, facial movements, right? All these different things. And then so much is expressed like through words, and then so much through like affect and emotion. And when the interpreter can't convey affect, it becomes really challenging. Yeah, I appreciate that. All right, we got one hand raised. Gwen, is there another question in the chat box? I don't know why I can't access it at the same time.
Yeah, I can actually, if these are two active raised hands, I can actually give you access to speak if that's okay now, Rebecca.
Yeah, absolutely.
Okay, so this is Kat.
Hi, Kat.
Oh, sorry. I will lower my hand. I didn't realize it was raised.
No
Okay.
problem. Looks like Casey might have a hand raised.
Okay. Both hands are down, so I'm going to assume that that means that that was from
Okay.
a hand raising situation.
Okay, perfect, perfect. Well, it's a nice small group, so please feel free, to share whatever, any thoughts that you have as they emerge. Okay, so okay, great. So that's about interpreters, right? We're going to move on. If for those of you who are in Natalia's training, there's going to be a little bit of an overview here. But when you're working with communities or with folks from different communities than your own, you are confronted with your own bias and you're confronted with stigma, right? And so bias is a tendency to favor or to lean towards a particular perspective, group, or idea, often leading to unfair treatment or judgment of others. Just to pause on bias, so through self-reflection and through supervision, I try really hard to acknowledge my own bias so that way they don't turn into microaggressions or affect my clients in any way. However, I do have some really strong biases, and it's a part of my own self-reflective process that I have to stay really attuned to them and when they emerge and when they show up. One, to be transparent in this, and so I'm going to be I'm going to share some stories. Obviously, what is said in this training stays within this training, even though it is being recorded. But for example, gender, I have some biases around gender and gender norms and gender roles. A lot of my clients come from countries in which there's a very specific role that women play. Women are more subservient. And so it's challenged some of my own inherent biases about women and just certain like feminist issues that come up. Another bias that I have is related to religion, and I've been confronted with that probably my whole entire therapeutic, therapy, or like the whole duration of me being a therapist for 12 years. And many of my clients are very religious, and sometimes that's hard for me. Not that I'm not, but many of my clients put all of their faith in their religion, and sometimes that impacts the therapeutic process because it takes away a little bit of agency and autonomy and power. And so I've had to figure out when I'm getting activated or when I feel sort of my bias coming into play related to that. Stigma emerges in this work as well. And oftentimes it's the clients that have a lot of stigma. As therapists, we work through a lot of that in grad school and continual supervision. And depending what kind of environment you've come from, you may have had to work through stigma, and you may still encounter it within your own communities and families. But clients come in with very strong stigma, which are negative attitudes, beliefs, and behaviors directed towards individuals with mental health. And this comes up all the time with clients. Therapy is a very Western, therapy is a very Western concept. Of course, we're trying to sort of decolonize it in different practices. But this idea that an individual seeks out a stranger to talk about mental health issues is foreign for a lot of people. Therapy was typically reserved for people in their village who were crazy, right? Or very sick. And so they have to combat all of these kind of public and self and structural and cultural stigmas to be able to show up in your office. And for myself, I'm like third or fourth generation therapist. So it's very challenging because I don't have, of course I have to manage the stigma in society of mental health, right? And I've worked in many mental health environments that perpetuated stigma. However, it's comfortable for me, right? So that's a difference between my clients and I. When clients get referred to therapy and wellness at NSC, my first question to them is, what is your understanding of our meetings? I have to find out, do they even know that they were referred to for therapy? Sometimes they are suggested by their case manager. I think you'd really enjoy this. It's a meeting. There's some extra support. So my ethical obligation and in an effort to almost decrease stigma, I have to warm them up in a really culturally sensitive and responsive way. I have to warm them up to what our meeting actually is, and to kind of combat some of these maybe more negative beliefs that they might have about therapy. That in and of itself is like a whole dance, really. So bias is about the individual preferences and attitudes that can lead to unfair treatment, while stigma is about that societal labeling and devaluation of individuals based on specific characteristics. Okay.
Rebecca, can I just interject here? We have a couple comments in the,
yes.
Yeah. So Casey says, I just wanted to say regarding pulling the interpreter aside separately to ask about affect, that it's challenging ethically because you don't want to allow interpreters to speak on behalf of the client or put words in their mouth. Casey also comments, there are challenges too when it's opposing genders, interactions of a cis female therapist and a cis male client or vice versa.
Yes. Yeah, absolutely. Yeah, and the interpreter, right? So anything that the interpreter says, or like anything that you say with the interpreter there, it should be stated to the client. However, the work isn't so black and white all the time, and I use this opportunity to make sure that the client had left to give me a little bit of information to then follow up with them again the next day. So yeah, there are some moments that aren't straightforward, but you're right about how to use the interpreters and what their role is ethically. But sometimes you have to, in that moment, I said, I'm going to use this person that's like a bit of a cultural broker almost, or not a cultural broker, really, it was still a language broker to help inform my next move, because the work wasn't over, right? The session didn't feel over for me. And then Gwen, can you share that last one?
Sure. There is also a challenge when it's opposing genders. For example, the interaction of a cis female therapist and a cis male client or vice versa. So I think when there's a mixed gender relationship happening.
Yes. Yes. Yes, that is huge in this work, trying to figure out the gender roles within this work. And hopefully there'll be a few more examples peppered through. One thing that I've learned is, like, come in with what you know about the culture and about the gender roles. Let that guide you and then hold it lightly. I've had so many interesting experiences where I was really surprised by clients and really surprised by you know, in some cultures and in some situations, gender is like, you know, a hard and fast rule. I don't want a male interpreter. I don't want a male or a female therapist, right? It's like really clear. And then in other cultures, you are seen as the professional. And so a lot of gender rules kind of melt away for some communities, specific communities, individuals. So it's always something to lead with, right? Like, how is my gender going to impact this relationship, and how does it impact the power differentials and power dynamics as well? And we'll talk a little bit about power later because it's so incredibly important, and what a gift of a tool we have when we get to play with it. Thank you for those comments and questions. So we're going to talk about microaggressions briefly. So they're subtle, often unintentional comments or actions that convey derogatory or negative messages towards individuals based on their marginalized identities, such as race, gender, sexual orientation, or disability, right? So they're subtle, and which makes them hard for therapists to recognize. And many therapists can feel uncomfortable addressing these topics, but discussing microaggressions can enhance the therapeutic alliance, similar to relationships where there are no microaggressions perceived. So I always find that really interesting, that addressing the microaggression is the same as not perceiving a microaggression to have even happened. That's how profound it is to address it. There have definitely been some microaggressions that I've engaged in, and because they are so subtle and often unintentional, I am not even aware probably of half of them, but the work is to continue that self-reflective process to bring them into awareness and to address them. So I've had, interestingly enough, a few clients who were refugees, were queer, and came to this country fleeing persecution due to their queerness. And something that's been so interesting is at various times, they both have wanted to identify as sort of like a cis, heteronormative individual, or have wanted to just be straight, or dress like a man and I'm going to have a baby with a woman, go back home and have a baby with a woman. And my initial response to both of these clients was absolutely, it was not like an overt, that's ridiculous. You went through all this struggle and trauma to get here to be your true authentic self. No, don't do that. This is the US, right? You know, like, you can be quick, all these things. Like, that's what I wanted to say. And what came out was likely microaggressions, right? It was likely, oh, you sure you want to do that? Or sort of like subtle, these unintentional comments. So that's another example of the ways which, like, my biases, my beliefs about the world kind of have been translated into microaggressions towards my clients. And then I did the best I could to honor that moment and point out, like, oh, my apologies. That's not what I meant to convey to you, and to continue to have that sense of openness and curiosity towards my client. And cultural humility. So cultural humility has been talked about, I know, a bunch in a previous session, and it's the approach to understanding and engaging with cultural differences that emphasizes self-reflection, addressing power dynamics, lifelong learning, and respect for others. So it contrasts with the concept of cultural competence, right? Which is focusing on the acquisition of knowledge, right? Cultural competence is like, I've arrived. We've never arrived, right? We're always on the train. We're always kind of, we're always trying to get there. So that's really important in our work. And there's a link between cultural humility and microaggressions, defining cultural humility as this open, client-centered approach to cultural identity. And therapists, being perceived as having high cultural humility, experience fewer and less impactful microaggressions. And when they do commit them, they're more likely to acknowledge their shortcomings. So that's important. understanding immigration-related stressors. So when you don't come from the community in which your clients have come from, there's so much learning that you have to do about who they are as individual people, and also what is the context in which they are arriving to this country. The challenge is that you can never fully understand the pain of their lived experience. You just can't. You can pull from similar, maybe some similar experiences, but you can't. Like it's just not something that you will ever know to the degree that they know and experience. And so you may feel shocked, right? Like some of the things that I've heard from my clients, like it has brought me like just serious pause. Like I felt shocked by it, especially in the beginning of this work. Now, the opportunity, the interesting pro sort of working outside of your own community is that you don't have to navigate that deep-seated pain, right? So it's a downfall, and it's also kind of helpful that you don't have to navigate that, and that your own experiences and pain is not being activated, right? So that sort of emotional distancing tool of not being from the community is helpful. So we're talking about acculturation and enculturation challenges. So discussing the stress associated with adopting new elements of a culture while also internalizing practices of one's own original culture. There's a lot of feelings of loss. So to acknowledge this is a topic where it is really helpful to know about someone's culture and to really commit yourself to knowing where they're coming from, and also really understanding your own client in the context of their own life, right? Something that's so small and minor, you might not perceive as a huge challenge. And maybe for them, it's really challenging. The example of gender roles, right? This is when that could, a gender role could fit in. Maybe someone has a chronic health condition and it requires them to go to the doctor, and their doctor is a female doctor. And just what, the challenges that arise from seeing this one person consistently who's in control of their own health and wellness, and yet having some confusion around the gender challenges and working so closely with a different gender. So that's, an example. The other challenge is the discrimination experience that clients face. So recognizing and validating experiences of discrimination and how this affects mental health. This is not just about their when they were in their home country or their journey over here. Oftentimes the discrimination experiences happen here in this country. And I have found that is incredibly painful as a therapist working with refugees and asylum seekers. Almost those are the most painful experiences, right? And sort of where do we hold that pain when we're hearing our clients talk to us about these moments? I had one client who was a trans woman, and, she faced persecution, of course, and she came here, but she'd never experienced the trauma that she had gone through until she came to this country. And it was the one client that just, it really, really got to me. I just remember this feeling so specifically of like, wow, she went through all this, and then she came here, and then her trauma really started. And that sits with you. I remember I was actually going out to dinner with my supervisor, who wasn't always in town. And I just had this session with this client, and I was just holding the weight and like detesting the whole city, walking through the city, just feeling like, oh, you're dangerous. Like you did this to her, you did this to her. So it's interesting how you really have to explore the discrimination experiences that they go through, every part of their journey. And then you have to figure out, what do you do with that, right? You're the container, you're kind of holding some of that. You're trying to make sense of that. There's a lot of experiences of that. Just to pop back up to sort of acculturation and enculturation challenges. A lot of this comes up as well when families are navigating, when the kids are navigating, what does it mean to be here, right? And as a therapist, you can kind of become a bit of a cultural broker for your clients as well, as they are navigating what is the life I left and what is this life here? How do I want to live? And then when you overlap trauma, it's this whole other discussion. There was one client who had gone through lots of sexual abuse and physical abuse, as well as her daughters had. She came to this country and then she had her youngest kid. She's a very strong woman, very prideful woman. And her daughter kept going to school and seeing the other kids' parents reflect back how, I love you, see you later, hug, like seeing all this sort of warm parental kind of activity at drop off every day. And she would go to her mom and she would say, why don't you ever tell me you love me? Like, why don't you ever give me a hug? And it was interesting because it was one cultural. She came from a very matriarchal society. It was cultural and it was trauma, right? We don't trust people. And so there were these two things that made her feel very different. And so a lot of our work was she wanted to show her youngest daughter that she loved and she cared for her. And so, we did almost like different exposures together, getting her to at times even verbalize sentiments like, I do love her. I love my daughter. And she wanted to touch her. She was saying that when her daughter gave her a hug, her skin crawled, right? So she was having like a trauma sensory reaction to her daughter. And slowly over time, she became able to express affection to her daughter, both physically through a hug and to give her that validation, that verbal validation, like, I do love you. And that was a really great moment because she had said that back home, no, the women of her village were not hugging and they were not warm. And maybe that was trauma, maybe that was a cultural thing. But through our work together, she was able to do that. And I was so glad that with that client, I led with my curiosity, right? I knew some stuff about where she was from, but I let her tell me how she wanted to approach this challenge in her life. And that really guided our work. So feel free to pop this into the Q&A. So I have this question down here at the bottom, but how do you stay present and grounded when you're in your own success? What helps you? Let's see if I can go to the Q&A myself. Okay. So feel free, pop that in whenever. So how do you stay present and grounded? Does anybody ever do like people have grounding techniques? Are there any sort of like physical things people do prior to a session to help get them embodied and present? Tend to put half of my attention on my solar plexus and attend to deep breathing. That's great. Thank you, Peter. Okay. All right. Well, something to think about how you stay present and grounded. And it changes for every person. Respecting cultural or respecting diverse and cultural backgrounds. So learning to adapt to therapeutic interventions to align with the client's cultural backgrounds and preferences. Okay. So when I think about this work, I always think about you play with power, which I think, Casey, we were starting to talk about that a little bit earlier. Play with power, use your cultural knowledge, right? Your kind of commitment to learning, and then also be prepared to be surprised, right? Let your client tell you that they are so many other things aside from these things that you've learned about, these qualities you've learned about in a book, right? So the power thing is huge. Playing with because it is what we have to do as people with privilege, right? We have to figure out ways to enroll our clients, maybe in different versions of themselves in the session. This group I was doing for a long time, I knew some clients wanted to see me as the expert, right? I was the expert. I was the doctor. I was not a doctor. I was a teacher. I was not a teacher, right? But they wanted to see me in this role of power. And other times, clients wanted to see me as their daughter, right? So playing with transference and countertransference is helpful too. They wanted to enroll me in this position where maybe they felt like they could teach something to me. They could tell me a cultural phrase or cultural nuance. So that's really helpful. Even something that comes up with through the use of interpreters is I like to do sort of idiom and like sharing with clients, because language is culture, and it's such a like window into understanding someone. And so when I want to express something, but it's in like a certain phrase, like a metaphor, I will still say the whole sentence, and I will have the interpreter describe it. I will like describe it to the interpreter and what this phrase means. And then oftentimes clients go, oh, that's so interesting. We have a similar phrase in my culture, and this is what it means. So it's interesting because it functions as like this like co-sharing space where we're both kind of swapping ideas about ways to understand the world through language. So sometimes it's about being an educator. Like I said, sometimes it's about enrolling yourself as like their daughter, their wife, right? There's all sorts of ways you can play with power in sessions, which are incredibly helpful. You have, and figuring out how, well, we'll talk about that a little bit later. Let's see. Other important things is just to use your, the cultural knowledge. As an art therapist, I have to be really mindful. Maybe this is going to kind of tie into this next slide, which is about tailoring approaches. We'll just move on to that slide. Okay. So tailoring approaches encourage therapists to use creative methods within their scope and training to engage clients, such as art therapy, music therapy, storytelling, or community-based interventions. There are so many ways to involve clients deeply in the therapeutic work. Sometimes it's also important to recognize maybe some resistance, right? Or some, if resistance is the right word, but to meet the client where they're at. There was one client who probably was upholding a lot of stigma around mental health. And for about 30 minutes each session, it was painful. Like I almost closed this client out and had multiple conversations initially. And I really was thinking, I don't think this person wants therapy. They're just for the 30 minutes, it's painful. Like we're just sitting in silence. It's, how are you? Like small talk. I couldn't get through the small talk. He spoke Arabic and we had a consistent interpreter. And then finally I said, I need to just stop fighting with this. It's just, let me roll with this. Let's see what happens when I actually hang out for 30 minutes with this client. And we started to make coffee together with the interpreter, right? So we would show up to the session, a lot of niceties, a lot of nonverbal communicating, a lot of being with this person. And I said, all right, we're going to make coffee. And that just became our ritual. And then we would do a 5 senses activity around the coffee. All right, let's all pick up our coffee. Let's hold the cup. Let's see how it feels. Let's smell the coffee. And then we would do storytelling about coffee. You know, what does this coffee remind you of? And he would tell me stories about his parents and about war and the different things that it reminded him of. And it became such a rich intervention that really came out of this place of one, I know people from different parts of the world love hot drinks, right? And food during therapy. Whenever I did group therapy or even individual therapy, I would try to have snacks, things to make it more comfortable. But there's this culture around drinking coffee and tea for so many people. And the focus was not about what's wrong with you. Are you sick? Right? Are you bad? It was, let's explore this coffee and let's just fill up the space with like interesting thoughts. And from there, we were actually able to do some really interesting and really great work, but I had to roll with his experience. I had to meet him where he was at. And then we worked together for a while, and he was much more open, but we had to have this 30-minute warm up together and grounding experience. And that was a moment where sort of my more rigid self, who really wanted to like see things move in a particular pace, where I had to really challenge that. Other ways to tailor interventions. As an art therapist working with a lot of folks, a lot of Muslim clients, you can't create the human figure. At least most people don't create the human figure. And so that's always been an interesting thing, and like a bit of a challenge at times, because so much of our therapy is, you know, draw yourself, draw you and your family, all these different things. And so I've tailored some interventions to, you know, have things not be related to human form or human figure. So that's something that's really specific. Clients, therapy is foreign when it's just you're talking to a client. It is helpful to be more experiential. And so this is my plug for other people to get comfortable, receive additional trainings, and to really understand your own scope and your training of what you offer to clients. Maybe some somatic practices would be helpful. Art therapy and music therapy are actual master's and doctoral degrees, so you can't just like use those techniques. However, if you are interested in utilizing some art making in sessions with your clients, it's helpful to consult with an art therapist. And this is my sort of like cautionary tale. One, it's a practice inside of your scope, but two, it's that when you're working with trauma and you're working with clients of different backgrounds and cultures, one, art means something different, and different materials mean something different to different people. And from a trauma perspective, materials are seen in a continuum from structured to unstructured. And so the most structured form of material would be collage, and then a pencil with an eraser, right? You can undo it. And then you start to get into drawing materials and then painting materials and clay. And so sometimes people with very good intentions who want to engage their clients in maybe more culturally reflective interventions will give a client a material that is actually really unstructured and really activating and really regressive. And what that will do is, one, if it's super sensory related, it could activate some trauma memories, like a wet clay. And it's not going to be supportive. It's not going to show your client in their most supportive, helpful way. So when in doubt, collage is always good if you want to use some interventions like that. But this is a part of the work where you have to commit to learning about your client and their culture, really tailoring the intervention to them. You can also ask your client about their own practices, their own creative practices, their own healing practices, what practices are done within their community, what practices are done, could be done within the space of therapy, and kind of keeping an ear open for that. And then, of course, it's important to collaborate and build community. And the one question, whenever we get referrals coming in, the one question that I always have for people when they want their client to have therapy is, how connected is your client to their community, all of the various identities that they have? And if they're not very connected, I'll encourage case managers, well, why don't you see if you can drop them into their church? Or why don't you, maybe there's a community center. Are they interested in going to a community center for this particular activity? Sometimes clients don't want to be involved at all with their community. It's very activating. It doesn't feel safe, but it can be incredibly helpful. We have to remember that therapy is not the end all be all. I think therapy is amazing and awesome, but when we're working with people from other communities, we have to remember that maybe the healing can actually happen within community. Maybe the healing can happen within their women's group. It doesn't always have to come from our more clinical perspective. We are not the end all be all. So that's also my plug to really investigating what are their interests and how can they be supported. Because therapy is another foreign language to a lot of our clients. And that's something that I've had to undo some learning on for myself, that not everyone will benefit from therapy. And actually the first line of defense, like the best thing might be basket weaving with other elder women in their community, right? Maybe therapy still is important, but maybe it's less important if they reduce some isolation and are engaged with women similar to them or folks similar to them. All right. Oh, there we are. Perfect. So I wanted to save some time at the end to see if there were any questions. So the training today was about working with folks from different communities. When you don't share the same community, you don't share the same language, you don't share the same cultural understandings, and all of the challenges that arise in that. So in reflection, feel free to take a moment to think about, what are the areas in which I struggle in this work? And any other kind of lingering questions or any lingering thoughts that you might have about it.
And feel free to raise your hand. I can unmute you if you prefer to just say it or use the question and answer box.
Great.
Rebecca, what people are thinking, I wanted to ask you, we had mentioned earlier, somebody brought up the idea of like the interpreter not demonstrating the emotion. And that's totally possible. And we always have to kind of check on interpreters. But I also think about, I know one thing I've learned from being at NSC is that cultures express emotion so differently. And if the interpreter is from that same culture, that might be what's happening. Maybe not, maybe, we don't know. But then it also made me think about body language and the difference of body language across cultures. And I've learned so much from our colleagues who have taught me crossing your arms in one culture means you're listening, whereas in typical US culture, we might think, oh, this person's defensive, they're protecting themselves, there might be this thing. So I'm just wondering if you have any advice on how to sort of stay open to those things and not jump to the assumptions.
Yeah, no, that's absolutely great. It's kind of like the one slide, let me see if I can find it, that I wrote down. What did I say? Play with power, use cultural knowledge, and be prepared to be surprised, right? So like I kind of remind myself often, be prepared to be surprised, be surprised. You don't know everything, be surprised. Because you just have to have that openness and that curiosity. Because then when you realize, oh, this means I'm listening, all of a sudden it's like your world opens up. You look at clients so differently. I also say, be curious and ask your clients things. You have to sometimes be careful about being direct with some clients that maybe aren't so direct in their communication. Maybe that's seen as like threatening or confrontational, but there are very tactful and quiet ways that you can explore those things. You know, if you see a client doing this, you could do like a little scan about like, okay, how are we feeling right now? Are we feeling comfortable? What, you know, is there emotion coming up? You can lead with that to understand, oh, maybe this is a little bit more, I'm present, I'm listening. Did that answer your question? Or did I go off on a tangent?
Yes, no, I think that's, I know that as long as I've been at NSC, I still am learning those things. I find them fascinating. And I'll thank you. And I'll share what Ava Isabel asks in the question answer. When you say that therapy isn't always necessary and there are other forms of healing for a client, can you explain a bit more on that?
Yeah, I think it depends on what the client is asking for. There's a difference between what the client's asking for and what we want for the client. So I think that's the important distinction. We may want healing from trauma for our clients. That way they can move through the world easier, but they might want to talk to someone and be less isolated, and have a difficult time with the idea of therapy. And those are the moments where it's like, okay, maybe we could find a community center. Maybe we could find a religious community. Maybe I've had clients who want to engage in altruism, right? So they start volunteering. They walk dogs at a shelter. And suddenly that gives them the sense of purpose or the connection where maybe they still have lots of different trauma symptoms, but maybe they've actually decreased because they are feeling less isolation and more connected. And then maybe that helps their sleep. And then maybe that helps their relationships. Like we can never fully know what the impact is going to be. So yeah, can you explain other forms of healing? There are also things where I remember I worked at a hospital once, and someone maybe had like schizophrenia or some mental health diagnosis, and I think we brought in like a medicine man from their community to perform a ritual. That, you know, some of the doctors were like, this is ludicrous, this is ridiculous. However, if it's going to help your client, and if it's the belief of this culture and this community, then that should be the first line of treatment. Always, if you can, go to the first line of treatment from within the community. If the first line of treatment is like, you know, physical violence and harm and all of that stuff and emotional abuse, okay, maybe we don't do that. But I always say start there.
There's another question here from Peter. What concepts or words that might seem essential to an English first language therapist are perhaps the hardest to find meaningful translation for?
I mean, all the ambiguous languages are hard. Ambiguous words like resonate, I'm sitting with, you know, how do you move through the world? Like when you are doing a really effective job of translating, it's like best when it's clean and clear, right? Please sit here. What is your feeling, right? You know, like when it can be really clear. However, that's not therapy. Therapy's art, right? Therapy is like this ambiguous, lots of ambiguous language, soft language to describe hard things. And so I find that the ambiguous language, the way that we get to the hard stuff through the soft words, that's the most challenging, language stuff. Yeah. I don't know. What do other people feel? Because this is a great question, Peter. Concepts or words that seem essential to therapists, but maybe they're the hardest to find translation for. So I'm saying some ambiguous language to soften challenging concepts, but any other thoughts from people? What's been challenging? Yeah, and maybe just Gwen, yeah.
No, I can add something. I know our clients always get thrown for a loop when they go to see a doctor or therapist, and they say, "Why are you here today?" or "What brings you here today?" I know that's always super confusing to our clients because they're like, "You're the professional, you should know why you're here." So I know that I've heard that from a bunch of people. And that's a really common way to sort of lead into.
Yes.
Oh my gosh. And that's so fantastic because that's such a fundamental difference, right? People from other communities go to the expert for the information. In this approach from therapy, we are telling a client, we want the clients to tell us what they experience and what they want, right? So it's like it's once again, it's a power difference. It's sort of like being told versus what is your expectation of this visit, you know? Yeah, Casey says authentic self. Yeah, Casey, this is great. Authentic self. What is an authentic self? And for our clients who come from collectivist societies and not such individualistic societies, the authentic self, who cares about the authentic self? I was working with an interpreter and who was functioning as a cultural broker. And one of the questions I always tend to ask clients in private practice and is just basically like, how do you describe yourself? Or what are some characteristics you would use to describe yourself? And instead of like, what are your strengths, right? I say that, that's why I adapted that. And she told me it's not culturally appropriate to talk about yourself. Like, and she said it in the moment, in that session, in the moment. I was so appreciative. I said, okay, great. She said, can you please rephrase that? I was like, okay, brain, make this work. That's why I love this work when you're working with a fantastic interpreter, because it's like, it's in the moment, it's hard, it's challenging, it's fruitful though. And I said, okay, how do your friends and family describe you? You know, it's just the only thing I could think of. Because yeah, to talk about yourself also is really like self-involved or just not community focused. But if you're asking, hey, community, how do you see me? It's a little bit different, but the authentic self is. Yeah, any other questions, curiosities, comments on this work and how it's felt for you? Okay. Well, I'm noticing we have about 2 minutes left. So I just want to feel free to have any questions come through the Q&A if you'd like. Also, I know I had mentioned any consulting that you want to do related to like art materials or the art therapy world or other creative practices. You can always reach out to me. I can make sure my information is out there. If you ever just want to talk about how do I translate this one sort of creative intervention to make it culturally appropriate and also stay within maybe my scope. I have one quick story based off of this in like the 2 minutes that we have. In this one group that I was doing, it was men and women from all over the world, all different cultures, backgrounds. We were making lanterns and we were talking about this idea of like darkness and light. And we did something that was very practical. But the people were using little tiny like saws to cut little tiny pieces of wood. And at the end, I noticed that one man in particular was really aggravated and agitated. Turns out this project, he was an intellect, he was an older adult, and he studied philosophy and religion stuff, but that was important information for me. And I then had to adapt our next group topic to make sure it really supported some of his own strengths. So that just popped into my head about like adapting materials and interventions. But I have so many stories about that, as I'm sure all of you do as well. Continue to stay open and reflective, continue to do great work. And when you're not the right person, refer out, right? That's the best thing that we can do for our clients, whether it's about culture, community, or just not having the expertise. So thank you all so much.
Thank you, Rebecca, for that. That was wonderful. And for everyone else, just a reminder that we will have a lunch break until 1:30 is the next time that the last group of sessions will be offered. So see you in a bit. Thanks again, Rebecca.
Thank you.